So I was put on a 6-month chemo, whereby they break it down. It's twofold. The first one is the one that I used to get every 3 weeks, okay, for 4 times. I get that chemo every 3 weeks. It's called the AC. It's red, like it looks like blood when you see it from a distance. They call it, they give it a name called the red devil, because it is so harsh on your body. You know, the first time when I got this chemo, I was still fine. So the first day I get there, I'm thinking, what is this chemotherapy? My God. So they put it on a drip, and it runs through your veins. And you actually don't feel anything whilst you're still having treatment. I didn't feel anything. You know, they give you some medication to deal with the side effects before you do chemo, and they give you medication to deal with side effects when you're at home. So they would ask me, are you okay? Do you feel like you want to vomit? I said, no, I'm fine. And I was fine. I got home, and when I got home, oh my God, I started to feel hot flashes, a bit of nausea. Of course, they gave me medication to deal with all those side effects. But I think the biggest thing for me, it was hot flashes. I felt so hot. I felt tired. You know, all I wanted to do was to sleep. The doctor booked me off the whole week when I was having this chemo. So every 3 weeks, every 3rd week, I was not working because of the chemo. The red devil was horrible. I just couldn't cope with it. You know, the first 2 days after having had this chemo, you would vomit. You know, you spent a lot of the time in the bathroom than anywhere else. The first 2 days. And that's when I used to drink a lot of water, a lot of fluids. You don't even have appetite to eat. Nothing tastes. I mean, you could eat anything that you want, but actually nothing really has the taste. So most of the time I would drink, you know, fluids like tea, I would drink juice, I would drink water, but nothing really went down my stomach and stayed because of the chemo I was on. So I had that 4 times, and after that I then had a weekly one, which is called Taxol. Taxol is actually a bit light in terms of how you get the side effects. It's not as bad as the AC. The only challenge that I had with Taxol was the vision. My vision became blurry, and I was actually quite concerned what was happening with me. But that's actually lasted for like a couple of weeks, and then maybe 2 weeks, then I was fine. But the thing about Taxol is that you are always tired. You know, that's when now the fatigue kicks in. You are always tired, and simply because you have to have this chemo on a weekly basis, you know. And I think what helped me cope with all of this is my family. The other treatment that I had to go through, whilst we're talking about treatment, is surgery. You know, I went through to do surgery, which is mastectomy. Because of the severity of the cancer, I had to do mastectomy. Mastectomy means that I have to remove the whole breast and the lymph nodes under my arm. And it was very disappointing after that to find out that actually, because the reason why we have chemotherapy before surgery, we're trying to kill the cancer, or we're trying to get rid of it the best way. But then the results that came back from that was that actually, when they took out the lymph nodes and they sent the lymph nodes to the lab and the whole breast, they found out that the cancer was still there. They were hoping that with the type of chemo that I did, it was going to clear me some sorts, you know. Yes, we don't know how many lymph nodes were affected before I had treatment. We only know that there was cancer, but in terms of how far it went, we didn't know. But then 11 lymph nodes were removed under my arm, and 9 were still positive after 16 cycles of chemotherapy. It was disappointing, you know, and my doctor didn't hide that information from me. It was quite a concern to say, we didn't hope for this, we didn't expect this, but this is where we are now, okay? However, the surgical margins from mastectomy were clear. You see, there's always the positive to look at. Now that means that they have removed all the cancer from the breast, but it doesn't mean that they could have gotten rid of everything. They've done everything in their power to get rid of the cancer. So that meant that after the surgery, I didn't have an option to do reconstruction. So one would expect a woman with two breasts. As you can see me, you would think I have two breasts. In actual fact, I don't. I only have one breast. That's another reason I had a decision I had to take, because it was quite a complicated operation. My surgeon tells me that, but she got rid of the cancer. I remember, I think I was there 4 to 5 hours in theater, you know. It was a bad cancer, she says. My radiation oncologist, he's a very nice guy. I mean, he told me that, look, radiation is not painful. Even when you're doing it, you're not going to feel any pains. Only after radiation, you're going to start getting the side effects, which is fatigue. You're always tired. You always want to sleep. That's what I'm going through now, that I'm done with radiation. I am always tired. But he advised me to actually have a routine of some sort of an exercise. So I go to the gym every morning, or sometimes twice a day. You know, I run, I cycle. But of course, because of another type of treatment that I do, which is an estrogen blocker, it's called Herceptin. There's an injection that I'm taking every 3 weeks. It's an estrogen blocker which blocks the cancer to receive, I believe, estrogen. Because when I was diagnosed, there's something that is called a HER2. It's negative or it's positive. My one was positive, and when that is positive, it means that the type of cancer that I have has got something to do with estrogen levels, my estrogen levels, which is why I now have to get Herceptin every 3 weeks. Now, one of the side effects of that is that it affects the heart function. Every 3 months, I now have to go through a heart scan to scan the heart to see, is the heart still functioning properly, and all of that, because Herceptin then affects the function of the heart. You know, I'm almost halfway through the Herceptin because I have to get 18 treatments, but I only had to start with Herceptin after I finished with the AC chemotherapy, because you cannot use that in combination.